We know everyone's heard of a stroke, and we know they can be deadly, but there are things you can do if you are having a stroke or someone you know is having one to get them help and get them healed as quickly as possible. We've got board-certified neurosurgeon with us, Jagannathan, talking about stroke. So tell us basically, what is a stroke?
A stroke is damage to the brain that's caused by a decrease in blood supply. It's most commonly caused by two reasons. One is a bleed in the brain. We oftentimes attribute that to like an aneurysm or what we call intracerebral hemorrhage. And the other is from loss of blood supply secondary to a clot or through narrowing of the blood vessels.
Okay. And symptoms that people need to be looking for?
Common symptoms patients have often relate to dysfunction of the brain. So it would be things like weakness in an arm or a leg. Facial weakness is pretty classic. Difficulty speaking, visual changes. Oftentimes, strokes can have a precursor called TIAs, which basically mean that the brain has a temporary decrease in blood supply. So the symptoms start but then get better, and that's important to recognize and seek attention when you see that.
Okay. And how important is it to get help quickly?
It's critical. I mean, 40 or 50 years ago, a stroke was almost a death sentence in many cases. Now, because of advances in medicine, strokes can be very treatable. But the thing that's extremely important is timing. So it's important to recognize the symptoms and get treatment quickly, and to either call 911 or go to a local emergency room as quickly as possible if you're having symptoms.
Okay. And there are some risk factors obviously involved, things people can do to hopefully prevent a stroke, or after they have a stroke, things they need to really modify in their life.
Yeah, I think commonly what we see, obesity is a risk factor, high blood pressure, hypertension is another. Tobacco use, cigarette smoking is probably the largest modifiable risk factor that we see. There are some family conditions that are associated with aneurysms and stroke risk factors too. So if you have family members that have died early or have suffered from strokes earlier in their lives, those are factors to bring to the attention of your primary care doctor and seek attention.
Yeah. So people are living better and with less disability after a stroke these days, yeah?
Yeah, the most recent studies have shown that there is a medical treatment called TPA, or tissue plasminogen activator, and if that's given ideally within 3 hours, but at the latest within 4.5 hours of symptom onset, that can help revascularize or restore the blood flow to the stroke. There are also ways now in which we can go in through the blood vessels and clean out a clot that might be blocking the blood vessels, and in some cases even surgery. But it's extremely critical that this be done in a timely fashion, because the more of the brain that's damaged, the less chance it's going to recover.
Absolutely. So that's it. Quick as possible. You see those signs, and even if they go away, the symptoms, make sure you get help.
Exactly, yeah. It's common to have precursors to strokes, things like visual phenomenon, seeing things, seeing floaters, or temporary episodes where maybe you'll have a disturbance in speech that just gets better in a few minutes. And oftentimes those are warning signs that, if they're ignored, can be a precursor to a much bigger, more serious stroke.
Great information. Thank you so much. And if you'd like to learn any more about the symptoms, about what you need to do in case of a stroke, you can head to our website, 9and10news.com.
This Health in Focus is a paid segment by Jagannathan Neurosurgery.